Hello, my name is Jamie Cross. I'm a nurse practitioner and I am currently employed by a federally qualified health center in Decatur, Illinois. I've chosen to analyze the role of the Associate Medical Director who has oversight of recruitment and retention at this facility. The role of interest that I have chosen to analyze is the Associate Medical Director, Director of Recruitment and Retention. The role is to directly oversee physicians' assistants and advanced practice registered nurses in collaboration with the Chief Medical Officer. This position will work very closely with advanced practice providers and is responsible for recruitment and retention and ensuring initial and ongoing training and education for both new and experienced providers. This role was created in response to a lack of patient access to primary care services and poor provider retention. The Associate Medical Director, Director of Recruitment and Retention role was chosen as the role of interest for this analysis as it is a relatively new position that was created to address advanced practice provider issues directly. The focus of this analysis was to assess the qualification of the DNP prepared nurse practitioner in this role and address the creation of the role, educational and experience requirements, and assess how a DNP prepared nurse whose skill set and expertise could aid in improvement of advanced practice. When the role requirements were created for the primary requirement considered when evaluating potential candidates was years of experience as an advanced practice provider. Additionally, the job description doesn't even have any requirements as far as educational background or leadership experience. This role was developed in an effort to provide standardized onboarding and ongoing education to improve provider confidence and overall satisfaction, which would ultimately improve patient access to care, continuity of care, and improve patient outcomes. And this slide demonstrates my SWOT analysis. So strengths included in a DNP fulfilling this role include organizational leadership, integration of research, healthcare policy for advocacy in healthcare, and interprofessional collaboration for improving patient outcomes. The core competencies outlined by the AACN of organizational leadership, clinical scholarship, and healthcare policy advocacy are strengths that provide the DNP prepared nurse with the ability to improve clinician and provider retention and ultimately patient access to care and outcomes through understanding of organizational models, policy development, and practice management. The weaknesses that I have identified include lack of organizational understanding of the DNP role, varying education levels of administrative personnel, and difficulty balancing clinical practice with administrative duties. Weaknesses like DNP prepared nurses might find in fulfilling the administrative role include lack of understanding of the DNP, the need to differentiate the DNP prepared nurse role from non-APRN degrees, including nursing administration degrees, masters of business, and clinical nurse leaders. Also, there will be significant difficulty balancing the clinical practice duties, continuing to see patients with administrative duties. Opportunities improved include DNP support, improved support for APPs, standardization of practice, decreased organizational costs and provider turnover, and improved patient access to care. Through support for APPs, through expert leadership, standardization of practice through enhanced and standard onboarding, improved patient access to care, and decreased organizational costs related to improved provider retention will occur. And finally, the threats are primarily financial. The DNP prepared nurse in this role will include increased financial implications and increased salary requirements in comparison to MSN, RN, or PAs in this role. This slide shows my pest analysis for this role. A pest analysis was completed to predict how the role of Associate Medical Director, Director of Recruitment and Retention, and a DNP fulfilling this role will provide improved patient and organizational outcomes. Political implications include improved access to care and quality of care. The DNP will provide a personal interest in political knowledge and information. And increase integration of political education into nursing practice and increase knowledge of the value of collective influence. Economically speaking, the DNP will provide knowledge regarding excessive and escalating healthcare costs, as well as have an understanding of value-based spending and good financial stewardship. Socially, the DNP will provide experience and knowledge of appropriate response to workplace violence and hazards, and also improved understanding of social determinants of health. Technologically speaking, the DNP prepared nurse will provide proficiency in recent technological advances and improved ability to manage the adoption of new healthcare technologies. Gaps in literature that I identified is that the role of the Doctor of Nursing Practice prepared nurse outside of academic setting has not been clearly articulated or widely explored. I identified limited research comparing PAs and MSRNs with nurses with a DNP degree in leadership roles, and also history of inconsistency among health care leadership regarding the recommendation and promotion of the DNP as a standard of practice. Indications for future research. Inconsistent standing in today's professional environment. Again, going back to the lack of understanding and varying degrees in this role, in administrative roles, and comparison of the DNP prepared nurse to various education levels of administration, and further exploration of the barriers to the adoption of the DNP as the standard. To expand this role, there needs to be a dissemination of the needs assessment, identifying why the DNP would be uniquely prepared for this role, establishing common interests in the success of the role, so identifying stakeholders who and finding the common interest in why the DNP would be appropriate for this role, constructing a vision of the role and the expected goals of the implementation of the role. So those stakeholders coming together to construct exactly how they would like this role to be completed and how and what the specific goals of the role are, and then finally assessing the need for the alteration of these visions and the goals after implementation. And here's my references. Continue and continue.